card you have, before you even like go into little bed area, two things happen. First, you say you've checked your doctor's orders, you've washed your hands, then you come in and you're like, just awesome shit.
Oh well.
And then you introduce yourself like, hi, I'm your nurse. Doctor ordered a physical assessment for you. I'll be touching you and having you move about. Is that okay?
Yes.
Okay. Just see your wristband. Can you tell me your full name and date of birth?
Bao Li. Date of birth is October 17, 1991.
Cool. Do you have any allergies?
No.
All right. So first off, can you tell me who the president is?
Yes, Trump.
You know today's date.
8/8/18.
You know what time it is?
Oh, I would say around 11.
Okay. And do you know why you're here?
Checkup.
Okay.
That's it.
Check your vital signs, all the normal limits, no abnormal findings. Do you feel safe here?
I do.
Okay, do you feel safe at home?
Yes.
And you try to hurt yourself?
No.
Okay. Do you have any pain anywhere right now?
No.
Okay, good.
Because I think for my pain.
Then let's get started.
Okay.
Alright, so check skin.
Temperature.
Yeah, temperature, skin warm and dry. Then
I have to see you need it. I mean, you've already done it, but yeah.
I'm gonna go through your head, inch by inch, a little bit. No infestations, no lesions, no masses. Noted. So check your ear, look there, side, verbalize that ears are clean, no drainage. Sorry.
No, it's okay. It's okay.
Ears are clean, no drainage, and no lesions. And, all right, if you open your mouth, say ah. Yeah. Mucosa pink, no lesions. Uvula is midline, and soft palate is symmetrical. Okay. All right. Now, your lymph nodes. Remember, 2 hands, because both sides. You do your preauricular, postauricular, occipital, verbalize. You're checking all the stuff. Submental, submandibular, tonsillar, or retropharyngeal. Superficial, cervical chain. Deep cervical chain. Posterior cervical, supraclavicular. Full lymph nodes noted. Now I'm forgetting things.
No, you're fine. You're fine. This is still very helpful. See?
Yeah.
Lymph nodes.
Where am I at? Right.
Bottom of the page.
Yeah. All right. So we're gonna listen for through in the carotids.
Do I turn first or no?
No.
No.
So inspect that there's no pulsating masses. Listen for bruit.
Use the bell.
Yeah,
Bell.
use the bell.
Carotid cell is the bell.
Yeah. No bruit noted on the left and right carotid arteries. I think I got docked for doing the
Carotid by itself.
yeah carotid and radial pulses.
You have to do it against each other at the same time. I see.
I think I got docked because this is how I did it, and I forgot how she corrected me.
Wait, this is how you did it?
Mhm.
And like she docked you for it?
Yeah, because I was supposed to do it a certain way, and I forgot what it was. I think maybe Sean remembers.
Yeah. I don't think you
Yeah.
want to cross.
Because it's the same. Okay, the same one.
Stay on one side and use, instead of
so,
crossing your arms.
Regular rhythm, no bounding pulsations on the left or right side. Turn your head to the side, turn your head to the other side. No JVD on the left or right side. All right, so what do I have next? Sorry.
Olfactory.
So you will have, there'll already be alcohol pads here. So
For that.
yeah. So I will instruct you to, we're going to do a smell test. Close your eyes, please, and I want you to block one nostril. All right, you tear the alcohol pad and bring it to the patient's nose. Ask them do you smell this? So sniff. What do you smell?
Alcohol.
All right, block the other nostril. Smell.
Alcohol.
Okay, And then,
Snellen's next.
yeah. You state that you do the Snellen test, so Snellen test performed, 20/20 on both eyes, cranial nerve 2 intact for the nose. Patient able to identify scent with alcohol on both right left nostril, cranial nerve 1 intact.
Right.
Okay, so pen light for the pupils. All right, look straight at me. I'm gonna shine light in your eyes. There. Okay, pupils are equireactive to light, and hold it. An accommodation. Cranial nerve 3 intact. 3, 4, 6 intact. And then we're gonna do the cardinal. Feel good. Yeah, cardinal gaze. You know what I mean.
Yeah.
I don't know if you do the wheel or the
Or the
It's
age.
whatever you want.
Whatever you want.
anyway, you can tell the patient. All right, just look straight at me,
Oh, bad.
or look straight at my pen, and then follow where it goes. Okay. But you know what I mean.
Gotcha. Thank you.
Okay, so patient able to follow directions of motion without any difficulties. Cranial nerve 3, 4, 6 intact. And then can you smile for me and frown?
I don't know what the frown. No,
There you go. You got it. Good job, Bal.
Face muscles are symmetrical. Cranial nerve 7 intact. All right, so can you stand up for me? All right, and turn that way. What I want you to do is block under your ears. All right, I'm gonna whisper which you want you to repeat it for me. Okay. ABC.
ABC.
Okay. Cover the other side.
Okay.
Repeat what I say. 1, 2, 3.
1, 2, 3.
Okay. And go ahead and say standing. We're gonna do a balance test. So what I want you to do is no, face that way. What I want you to do is keep your feet together, put your arms aside, close your eyes, and then I'm just gonna see if you sway. Okay. And important, I'm gonna be right here with you. Make sure that you're safe and you're not gonna fall anywhere. Okay. And check it. You do it for 20 seconds. Let's say that goes by. Go ahead and relax.
I like trying hard not to sweat.
Stay standing.
So no swing noted. Cranial nerve
6,
8.
He's gonna answer that.
Yeah, and then there's the
Yeah.
gait. So what I want you to do for me now is I'm gonna see how you walk. So go ahead and take 6 steps forward and take 6 steps back.
That's a big steps.
But I don't walk backwards, right? Like I
No,
you
turn
turn
around and
around.
walk. Come back.
Like a catwalk. There you go.
And then what'd you say? Gait steady. Whatever.
Whatever.
Yeah. So
8 for balance.
I think 8.
8 and 10.
All right.
Mm-hmm.
You're going to have a seat. What I'd like you to do now is, can you stick your tongue for me? And out and move it left and right. Okay. And if I have a tongue depressor, say, I'm gonna make you gag. Okay.
I'm gonna throw up on you.
Yeah, please don't. All right. So patients able to stick out their tongue, able to move left and right. Gag reflex is elicited, so cranial nerve 9 and 10 intact. All right, so what I want you to do now is shrug your shoulders. Cool. And then shrug one more time. All right. Patient's able to move shoulders up and down with and without resistance. What was that? Cranial nerve 11 intact.
Mm-hmm.
Okay, so now we're.
No, that's yours. I'm like,
Yeah, it's my
I'm an intercom.
Okay, so next thing, so just sitting, I want you to put your hands on your lap, and I want you to flip them real fast for me. Okay, good. Patient's able to perform rapid alternating movements with hands without any difficulty. Upper cerebellar intact. Okay, can you stand up for me? I'm going to show you how to do this next test. What I want you to do is with your left leg, I want you to take your left heel, balance on your opposite leg, touch it to your shin. Not yet, not yet.
Oh.
And then drag your heel to your knee. Okay, and then same thing other side. Okay, and when you do that, I'll be right here. Make sure you're not gonna fall, okay?
Okay.
So go ahead and try it. Cool. Have a seat. Patient able to perform heel and patient is able to perform heel to shin with both feet, lower cerebellar intact. Okay, so take a look at your thoracic cage. It looks symmetrical. Well developed muscles. Shape is elliptical. You want to take other views.
Angles a bit.
Yeah. And then diameter is 2 to 1 with anterior to posterior.
I'll leave the same.
Yeah. And then, okay, stand up for me. Or, yeah, I can get stand up, or you can get sit
No,
up.
it's okay.
All right, so hands flat on the lower ribs of the rib cage.
So you're touching the lower rib.
Yeah. So what I want you to do is take a deep breath. Good, out, and turn around. Again, hands flat on the rib cage. Breathe again. All right, take a seat. Respiratory expansion is symmetrical, and then you're gonna. Well, I might have you lift your shirt up so I can assess your skin.
Mm-hmm.
So I'm gonna palpate. Skin is warm and dry. No lesions. No scars noted.
Did you do that though with you and Sean? Like, did you actually lift up? Okay.
Yeah. You check the skin color uniform. You do the tinting, no tinting, and you want to press in no edema.
Oh, right here. For edema? Is that what you do? No, I'm just curious. I don't know where to do. Like, I don't know what to do for the upright shoulder. I know for the lower is down here, but.
Just if you want to just push on the skin a little bit.
Okay.
And you see there's no.
Okay. No bulging.
There's no pitting.
Pitting.
Yeah, like when someone.
Yeah, it should come back. It should bounce back.
Yeah. When someone is edematous, like if you do the push with the pitting, like it'll stay in. Your fingerprint will like stay in. That's good. It's kind of cool.
It's cool. Yeah, I've seen it. Yeah.
All right. So next we're gonna test the muscle strength of your hands and your arms. So put your hands out for me, and I want you to flip your wrists up and down. All right. And then now push up against my hands. Push down. Okay. Move your arms up. Arms down. All right. Arms up again. Push up. Push down. Good. No difficulty with the range of motion. Strong, even muscle strength on both sides. And then we're going to do the deacon reflexes here.
This is kind of low though. Like,
No,
That's fine.
It's okay. It's okay.
I guess just going through the motions.
Yeah. Okay, so, just relax your arms like that. And you're going to keep your arms here for both the brachioradialis and the bicep tendon reflex. I'm still good on time now.
Yeah, good.
Okay. So, find the tendon for the bicep. Can you move your arm now like that? Very good. Go ahead and relax your arm. And then you
hit your thumb.
You get a better reflex.
Yeah.
And
Do
then.
you have to kind of explain what the reflex is while we're doing it, or no?
Yeah, I mean, I did it at the end. So I did
okay.
I did my reflexes and then explained it.
Oh, so you do have to.
Yeah.
Mhm.
Okay. All right. And since you're here, I'm gonna find your brachioradialis.
It's like 3 inches.
Yeah. So what? From the
Yeah.
from radial artery, and a few inches up from So.
Yeah.
Okay. And then for the tricep, go and rest your arm on one arm.
Yeah.
Okay. And then bend your arm again until we find the. Okay. Keep bending.
Oh.
And down. Okay. Yep. So say that both sides. Tricep, bicep, and brachioradialis reflexes are 2+.
Oh, that's all you have to say?
Mhm.
Okay.
Bilaterally 2+.
Okay.
And then kiss your hands again. Flip over. And I'm going to check your capillary refill. So go through each finger.
Less than 10 seconds, or less than 2 seconds.
Backflow is less than 2 seconds. And that's the hands.
Mhm. Heart.
All right, now I'm gonna listen to your heart
Okay.
sounds. So,
Normally you do under,
Yeah.
right?
yeah, you need to do it like on the skin.
Yeah.
I actually asked Sean to lift up the shirt while I did it.
Yeah.
I mean, the first two I can just pull down your collar and then
Yeah,
check
but the
out.
other ones.
Yeah, the other ones I have
Yeah.
lift the shirt up
Yeah.
and actually felt for the
Yeah.
for landmarks.
Uh-huh.
So when you do this,
I would, but we're in a public place. That's the only thing.
no,
Yeah.
I know. So when you check the heart sounds, you want to state that you are, looking for the actual landmarks. Verbalize that you're looking for the angle Louis, and say that you're looking for the aortic heart sound, which is second intercostal space, right sternal border, and then you listen for it. Bell, right?
Diaphragm.
It is bell.
No, diaphragm.
Only herbs is bell.
Herbs
Only
is
the
bell.
herbs
Herbs
is
is
the
bell.
Okay.
So, pulmonic
Yeah, you find it.
or
Aortic.
All people enjoy time.
Enjoy Time magazine.
This is for the aortic. It's the second intercostal space, right on the border. S2 is louder than S1. And then move to the next spot. This is for the pulmonic, the second intercostal space, left sternal border. Landmark is what angle Louis. And then S2 is louder than S1. L 2, 3. Herbs. Third intercostal space, left from the border. S1 is equal to S2. 1, 2, 3, 4. Tricuspid. Fourth intercostal space, left from the border. S1 is louder than S2. And then fifth intercostal space, make clavicular line. Oops. You're good. So yeah, fifth intercostal space, make clavicular line. This is for the mitral heart sound, and S1 is louder than S2. And what I'm gonna have you do is lean forward,
Oh.
and I'm just gonna have I'm gonna actually measure your heartbeat for a full minute. And you literally need to have your watch and like do it.
Oh,
and
really?
yeah.
Mm-hmm.
And they're timing with you
For an actual minute.
for a full,
Yeah.
for a full
Oh, I
minute.
see.
Yeah.
You can just
And
make up
then-
a rate, but
Just-
you need a minute.
Yeah.
Yeah. So
Make it
let's
up.
say 80 beats per minute.
Like maybe 74
Yeah.
or something.
Yeah.
Yeah.
Oh.
All right. So
Okay.
you take a moment to watch your patient breathe. Don't actually say that you're watching them breathe. And then you say respiratory rate is regular. Rhythm for inhalation and exhalation is symmetrical. No difficulty breathing. Then you start going with your lung sounds. So
This isn't like, yeah. Get a good angle because I'm gonna see the lung sound. You can. This.
Yep. Okay. So I do trachea last.
Trachea last.
Oh, okay.
I do the
I mean, you
same.
can do it first, whatever.
I do the
Yeah.
same.
So
Whatever.
you tell your patient. So you want to go for the apices. So they're
Mhm.
just underneath the clavicle. Okay. So what I want you to do is take a deep breath in and out. Good. Again. Again. Okay. Okay. When you listen for the bases, kind of get around the
To the side by the ribs.
the lower ribs. Don't go like
Yeah.
you hit the ribs because now you're listening to like abdomen stuff. So you want to listen to the base of the lungs there at the end of the rib cage. Okay, and then trachea.
Trachea last.
I do it last. You not.
Oh no, it's cool.
Yeah. So that is yeah, that's the anterior. I save the verbal stuff after I hear everything.
I'll turn.
Or you can do it.
As you go.
Yeah, you can do it as you go.
That's
So
cool.
Whichever way. I remember you're doing this actually on the skin, so
Yeah, of course. Shirt up
Yeah.
or tank top.
or whatever. Yeah.
Yeah.
Okay, so for the back, you kind of want to follow the scapula. So apices are up here. So what I want you to do, Bao, is cross your arms, put your hands on your shoulders. Yeah. Great, and kind of lean forward a little bit. Okay. All right. Deep breath again. Again. Kind of see how I'm like
You're
going
following
for a
it.
soft
Yeah.
spot, and then coming down and then checking the alternating side, coming down, checking the alternating
Right.
side.
Instead of crossing.
Yeah, because you want to do the bilateral comparison. All right, so bases 7 and 8. Since we're here, have your instructor kind of see that you're doing this. Check your lateral. That sounds. No.
Are those the two on the side?
Yeah,
Two
the
on
two
the
on the
side,
side.
Yeah, left, right. You don't need to tell the patient to like bend like this, right? It's okay if they're in that
I mean,
position.
I didn't, and I was fine.
Oh, okay, that's cool.
Yeah. And then like
Same thing on this
They
one.
need to see that you're checking this separate. Yeah. Okay. Here's when I say no adventitious bird
That
sounds
sounds-
heard. Breathing is regular, rhythmic, symmetrical.
Abdomen.
Are you going to relax? All right. So go ahead and turn back around. This is where we start.
Laying down.
No. Oh. So I'll ask you. Okay. So Val, when was your last bowel movement?
This morning.
This morning. Is that regular for you?
Regular. Yes.
Was it formed?
This form.
Okay. And any constipation?
No.
Any diarrhea?
No.
Any bleeding?
No.
Good. When was your last urination?
Like an hour ago.
Okay.
Yeah.
Is that regular for you?
Yes, I have a small
Okay.
bladder.
What color was your urine?
It was like pale yellow, like almost
Clear.
clear.
Okay. And any was there any pain and difficulty?
No.
Okay, good. All right. So what I want you to do now is have you lay back flat. I'm gonna check your abdomen here. Raise the bed
Raise head
To your
over
level.
head.
Yeah.
Yeah.
Make sure it has a pillow.
Body
All right,
mechanics.
and then expose the stomach. You don't have to, but you know what I mean. And then it's gonna be a small space, but you're gonna have to get down to the level. Check one side.
Mm-hmm. Other side of the bed.
This is the only time
Down
my
by the
stomach is
bottom
flat.
also.
Check from the feet, and then come.
Oh,
to
really?
Yeah.
Okay.
And come from the other
Okay.
side. Check the other side of the.
So
of the
you
abdomen.
inspect from 3 different angles?
Yeah.
Yeah.
Oh,
Wow.
okay. All right.
And then, what do you say? You take a look and you say no bulges, no lesions or masses, no strong things to obtain.
I didn't think so.
It's important. No strong.
Pulsation.
The first half of it was
Um,
really fucked me.
And
No, I know. I got probably.
yeah, no lesions, no scars.
You said spurs?
No lesions, no lesions, no
But yeah, like
scars.
Scar.
I think this was what the law was.
And then-
But
It's fine.
I thought the first was easy, but yeah, I don't think I failed. But I'm thinking like, what was that, 180 points?
You also listen
Plus
for your vowel sounds.
plus credit, plus the partial credit,
And then,
180
just
points.
I didn't have the long question.
What? You need a trial?
Oh, wait.
Yeah,
With the-
I
with
didn't
the-
do
bell.
any of the log questions. And
Yeah, with
that.
the diaphragm.
What was the diagram?
And then switch to the bell.
Oh, so you
Are you already on your nursing?
Yeah. Yeah. So that's the epigastric area. That's where you listen for the brewing for the abdominal.
Is it just like just right on it?
No, so you kind of imagine
Midline by
midline,
xiphoid.
then just go off an inch
To the left.
where you would.
Yeah.
So, no brewy, active vowel sounds noted. Active vowel sounds in all 4 quadrants. What else to say? Yeah, no brewy, no pain. Right? Okay.
Hey, you use the bell for all 4 quadrants, right? As
No,
well?
just
Really?
Just for
aortic
the triple A
aneurysm.
area.
Yeah, I messed up. So diaphragm for vowel sounds. Switch to the bell for brewy.
like through. Okay.
Yeah.
Okay.
Did you palpate? Like,
Not yet.
do we have to know? Do we have to? Oh, we do have to palpate.
Yeah, also you gotta do it in order.
Yeah. All right. So. Yeah. So now I'm going to percuss. So.
1 finger.
Yeah, 1 finger.
Oh. Oh.
And then you say symphony on all 4 quadrants. I should have asked about it. Let me know at any point. Tell me if there's any pain when I do this. So, no pain. And there was dullness when I palpated over the liver.
Right. We percuss.
Sorry, yeah, percuss over the liver.
That was.
Okay, so then now I'm going to tell Bell. I'm going to palpate now on your abdomen. I'm going to just push down a little bit. Tell me if you feel any pain. Okay? So.
Oh, and that's how we do it.
That's a light
Oh, just one
palpation.
hand?
No,
That's
so
light
like-
palpation. Yeah.
Oh, you do
You
like
have to roll
this?
it. Mhm.
Oh, I didn't know that. I would just go like, oh, good to know. Good to know.
Yeah, one hand for the light palpation and roll.
Oh, you roll. Yeah, I didn't
You
know
roll
that.
it, yeah.
I didn't like.
You didn't pokey?
Yeah.
So.
And then there's deep is 2 hands.
Okay.
I don't
Yeah.
think we do deep, do we?
No,
Shouldn't.
No.
because deep would be the
Yeah,
the 2 hands that you roll and you really get down there.
Yeah.
Okay. Yeah. So 1 hand light, and then you say no mass is noted, no pain, right?
Mm-hmm.
Okay. So then at this point, you can do the rest of your. At this point, you can kind of keep laying down. You can do your lower leg extremities. So at this point, like I would ask you, can you put your legs out? Put one of your legs out.
Like out?
Yeah, out.
Okay.
And lift it up. Bend your knee. Bend back out.
Oh, okay.
Okay. Now push down my hand. Okay. Push up my hand. Good.
He slapped you.
I'm like shaking.
It's okay.
No, it's,
Ab-
no, it's
ab
because
workout,
the
come on.
bed's not flat.
No, ab
Or
workout.
it's not like a full bed, so.
All right. Other leg. Straight leg out. Straighten your leg. Bend your knee. Straighten out again. Lift up. All right. Push down. Push up. All right. Good. And then since you're at the feet already, you're gonna ask your patient to point your toes up.
Put my toes up.
Point your toes up.
Yeah.
And then point your toes out. Okay. Then push up against my hands, and then push down.
Oh, I
So work
got
out.
abs, guys.
It's okay,
Well,
bro.
no,
It's alright.
Yeah,
It's
you're
alright,
right.
friend.
And then you say that patient has a strong bilateral lower extremity strength.
Oh, thanks for lying.
No difficulty with range of motion. Lower the bed back. You can go ahead and sit up.
Okay.
Well, sit up in the bed because now you're gonna check the skin. So you're going to feel skin is uniform in color, warm and dry. There is no pitting, so no edema, no lesions, no scars noted. And then for tenting, I forgot what you check. You can check. Yeah, you can pinch at the finger for tenting. So yeah, then I'll say that there's no tenting. Now I'm gonna check your patellar reflexes. So
This is gonna be hard, guys.
yeah, no. So you scoot up in the bed as much as you can. Have your legs relaxed. Just let it dangle off the ground. Then you find the patellar tendon, which is just below the kneecap, and then right. Side.
Yep.
Yep. So rotary, that's just normal 2+. And then, are you going to come forward a little bit? You check your lower pulses, so you feel behind the knee where the popliteal pulses, and then you say that both popliteal pulses are palpable, rhythmic, and symmetrical. Check your pedis pulses. State that both pulses are palpable, rhythmic, and symmetrical. And then
Dorsalis.
yeah, but I
Oh
just
no,
did the
plantar,
pedis.
the back one.
Yeah, and then
Posterior.
you do capri fill on each of the toes. So you are going to take your socks off.
Okay.
Be barefoot.
Okay. So clip my toes.
Yeah.
They're clipped.
You know,
I'm just saying. Yeah.
Put some lotion on, make sure you're not dry, whatever.
Yeah.
ID.
ID.
And then you pinch each toe, check the ankle, and then you say return backflow less than 2 seconds. And assessment complete.